But first of all, thank you so much, Claire, for the nice introduction. And thank you to, the group for the invitation to talk today. I'm very excited about this topic. And so we're going to be talking about climate change and reproductive health. I changed the title a little bit, but you'll see why. I wanted to make it a little more comprehensive. And so I just, want to begin with disclosures. I have no conflict of interest to disclose here. First thing is, what is climate change? I'm pretty sure we all kind of, we've heard about it in multiple, contexts, but climate change in this talk, we're referring to the long-term shift in the usual temperatures and weather pattern in a specific place. And there are, of course, right, undeniable evidence and general scientific consensus is that, climate change is happening and it is caused by human activity. And so there are a lot of physical, really more direct evidence, including the rising global temperature, extreme weather events, melting ice, rising sea level, and warmer oceans. And I'm going to talk about just a couple of pieces of evidence here. And the first one being, if you look on the screen here, you'll see that this is the global mean temperature difference. And the reference is from the years 1850 to 1900. And so you can sort of see there that the temperature has been increasing pretty significantly in the past century. And it is expected that we're going to reach 2 degrees higher than usual on average by 2050. And so, and kind of consistent with this, about 9 of the 10 hottest year in modern record has happened in this past decade. And so we can sort of see that the frequency of these really extreme heat events is becoming more and more common. And then we can also see that there is a significant increase in the prevalence, in the duration, and the intensity of various extreme weather events. And so you see here on the graph, it's a little small, depending on your screen and the screen in front of you, but this is the number of natural catastrophe worldwide from 1980 to 2012. It's color coded by the different types of events. So in red, you see geophysical. In green, it is meteorological. In blue, hydrological, and in orange is climatology, climate related. And so you can sort of see here, while geophysical events like earthquake hasn't changed that much over time, but we see there's a significant increase in natural disasters such as storms and extreme heat temperature, drought, and forest fire. So point here is we're seeing a lot more of these events that are potentially having severe health consequences. And so, needless to say, climate change has many known impact on human health. And here, on the left side of the screen, you see that, so for example, with the climate condition changing, we're expecting more air pollution potentially from wildfire, and this has implication on some of these, respiratory and cardiovascular diseases. We also expect to see changes in vector ecology, and so a lot of the mosquitoes, the species that we see in more warmer regions are now, we start to see them more in more sort of like more northern regions. And so this has implication on infectious disease. We also see with the warmer water, all these storms and things and flood, things like that, we start to see water impact and, water and food supply, water food insecurity, extreme heat event, extreme weather event, etc. And so we start to see that these have severe health impact here, right? Things like cardiovascular disease, like I mentioned, injury, fatal, mental health impact, etc. Forced migration, these are very important social determinants of health. And so, and because of all these, in 2021, the WHO declared climate change as the single biggest health threat facing humanity of the 21st century. However, the reproductive impact of climate change has not received the adequate attention needed to match its, the expected impact of climate change overall. And in fact, in 2022, so this year, this is the first year that the Intergovernmental Panel on Climate Change, this is the first time that they actually mention pregnant people as a vulnerable group for climate change impact. And by the way, this group right here, the IPCC, is basically a group of independent scientists, technical scientists, climate scientists, etc. There are basically providing this sort of like, regular assessment of the science, the social economic knowledge on climate change. So they report, they have these reports that's coming out pretty regularly, at least on a yearly basis here. And so, yeah, so 2022 was the very first time that they actually acknowledged pregnant women, pregnant people as a vulnerable subgroup or vulnerable population for climate change. And so so in 2022, in the same year, I'm really interested in the impact of climate change on reproductive health, because this is pregnancy at the very least. This is a very vulnerable period, and we need to take a look at this because it has implication on potentially the next generation as well, and I'll talk about that in a little bit. But I basically did a study and basically kind of tried to I guess summarize what's really known about the impact of climate change on pregnancy reproductive health outcomes. And so really consistent to what we saw on the previous slide, climate change has both direct and indirect impact on pregnancy outcomes. So these direct impact are basically the impact, the environmental consequences that have pretty much like almost immediate impact on health. So things like heat wave, wildfire, extreme weather events, these all have almost immediate impact on pregnancy outcomes through some of these biological, physiological changes like oxidative stress, inflammatory responses, endocrine disruption. So air pollution, for example, right? And they could also cause malnutrition and infections, depending on what we're talking about. But if somebody is experiencing like a hurricane and getting the disruption in their normal sort of livelihood, that definitely impacts some of those. And then we also have these indirect impact of climate change, and as you can sort of imagine, a lot of these direct impact, right, heat wave, wildfire, like I mentioned, they can have they can produce some of the more downstream impact on the physical environment, where they can induce air pollution. So wildfire, for example, can induce air pollution, and these storms can induce food scarcity and water contamination. And like I mentioned a little bit earlier, the shift in vector as well as host and pathogen distribution, which they increase the risk of infections and therefore may influence the risk of adverse pregnancy outcomes. And then some of these direct impact may lead to indirect impact through the social environment, including food and water insecurity, maybe conflict due to the resource scarcity that may happen because of for example, scarcity in terms of water and things like that. And I think very importantly, displacement. People get displaced around the world because of a lot of different extreme weather events. And then again, all of these can lead to psychological as well as biological changes that may interact with each other to produce adverse pregnancy outcomes. And of course, everything is happening right in kind of conjunction with whatever the existing influences are, and that include the health system, the social and physical environment that is existing already, and of course, the individual characteristics of the person that's the vulnerable, susceptible population. All right, and so and throughout this talk, I won't have time to dive into anything in specific, but I will share with you some of the work that I've worked on related to how heat waves, so heat, extreme temperature in general, and air pollution impact these pregnancy outcomes. And I, again, won't be going into any of the like the nitty-gritty details, but I'm happy to answer those if you have any question at the end of the day, or at the end of the seminar. And so first of all, let's talk a little bit about extreme temperatures and reproductive health. And from the cardiovascular and some of the early work, cardiovascular literature and some of the early work in animal studies as well, on the health impact of extreme temperature, we can extrapolate it and kind of, hypothesize that extreme temperature may induce or may reduce uterine blood flow. They can induce hormonal changes. For example, there are animal studies that showed that extreme temperature can increase the level of oxytocin and prostaglandin, and these are all hormones that may induce uterine contraction and induce potentially early delivery, for example. Extreme temperature can lead to heat stress and therefore may induce oxidative stress and inflammatory markers that may impact the risk of preterm birth. And then uterine contraction activity can be induced by extreme temperature that could actually lead to preterm birth as an example. And so the work that I've worked on have shown that extreme temperature exposure are associated with health outcomes for both the growing fetus inside the womb and the expecting mother. And then I had some work that is just for the adult in general. And so these are some of the outcomes that we've seen associations with. So stillbirth, premature rupture of the membranes, which is the number one reason for preterm delivery, and then preterm delivery and term low birth weight for the baby. So those who are exposed to extreme temperatures have higher risk of these different outcomes. And then on the expectant mother side, we also found that extreme temperatures may be associated or may lead to the risk of cardiovascular event around the time of labor and delivery for pregnant women. We also had some study that shows biomarker changes, and it shows unfavorable biomarker responses in people who are exposed to extreme temperature, sort of almost immediate within a couple days responses. And we also saw association with stroke and infectious disease outcome as well. But for the sake of time, today I'll be sharing some of the findings we had on the associations between extreme temperature and preterm birth for the baby. And then I'll show you a snippet of some of the findings we had for cardiovascular event around the time of labor and delivery for the expecting mother. And so so let's focus on early delivery first, so preterm birth in general. And so this is a paper that I published not recently, but a number of years ago, but it's relevant to this talk. And so for this paper project, I was interested in seeing whether pregnant women exposed to extreme temperatures during pregnancy, whether they have an increased risk of having an early delivery. So I use a retrospective cohort of about 220,000 singleton delivery in the across 12 sites in the United States from 2002 to 2008, and of course the exposure is temperature, right? So we estimated temperature across the study sites, essentially across the United States, using this weather research and forecasting model. And this is a model that's developed in collaboration between academic institution and governmental agency. And it is used for the main purpose of the use is for research purposes as well as for forecasting needs across the nation. And so I use these daily average temperature, and I spatial temporally linked them to the women in their region, so that we didn't have addresses of the mother, but we linked them to the hospital region that they were in, with the assumption that they would live in that area. And temperature doesn't change that much, and we'll talk about that a little more too, across a space, across a specific region, I would say. And then the outcomes that we were interested in included early term birth, which are birth that are less than 34 weeks of gestation, late preterm birth from 34 to 36 weeks of gestation and early term birth, which are 37 to 38 weeks. Now, we are particularly interested in this group because they typically are not defined as preterm, but they're not term either. And this group actually has the NICHD actually had I can't remember the time, but they were like specifically wanted to focus on this group because they do have increased risk. It's just but somehow they're not term, and so they still have risk. So, but no study was really, not a lot of study focus on this group. So we decided to do that. So in terms of exposure to temperature, extreme temperature, we're interested in both sort of like the chronic exposure and the acute exposure. So like, exposure over a long period of time versus the recent exposure. So I'll talk a little bit about the chronic exposure definition that we are interested in. So we're so for this type of exposure, we're averaging daily temperature across the 3 months preconception. And so we wanted to see if there's sort of like preconception impact. And then we also average across the 7 weeks window during the first two trimester and the whole pregnancy. And you note here that we don't have a third trimester because the reason is because a lot of preterm births do not have a full third trimester. And so we didn't want to, compare the preterm birth with the ongoing pregnancy because the length of the average is not going to be the same. So we did not look at third trimester, but instead the third trimester exposure, we're going to look at those as an acute exposure later. And so in order to adjust for acclimation, right? So a 90-degree temperature for somebody who lives in Chicago is going to feel very different from a 90-degree temperature for somebody who lives in, say, the San Joaquin Valley, where I am right now, because 90 is nothing to us, but 90 is a big deal to people who live in more northern, or maybe in Michigan right now, right? So in order to sort of account for that level of acclimation, what we did was we defined hot versus cold versus hot exposure using site-specific temperature distribution. And so if somebody were to be exposed, right, over this period to cold temperature, they would have to be at or below the 10th percentile of the site-specific temperature distribution in the sample. And then if somebody were to be exposed to the top 10 percentile, so more than the 90 percentile, they will be considered as having a extreme hot exposure. And they will all be compared to the mild reference, of course. And we chose these cutoff because of the literature and other basically overall literature. And so here are the findings. So the first here, I will orient you, this is the adjusted relative risk. And this is the different windows. And then this is for early preterm delivery. So the most early category of preterm birth. And so you can sort of see here in blue, we're talking about the risk for the extreme cold group compared to the mild group. And then in red is for the extreme hot compared to the mild. So you can sort of see here, extreme hot and cold temperature during weeks 1 to 7 was associated with higher risk of having an early preterm delivery. And then we see here again in weeks, this window, week 15 to 21, we also see an increased risk associated with extreme hot temperature exposure. And this is for, same slide, but for late preterm delivery, so around these weeks right here, 34 to 36, we saw somewhat of a consistent pattern where extreme hot here, actually this is in preconception, extreme cold in the first 7 weeks of pregnancy, and then extreme hot in the weeks 15 to 24 were associated with increased risk. And then on the next slide, same style again, but this is for early term delivery. So between 37 and 38 weeks of gestation, sort of almost similar pattern as well. Both hot and cold extremes were associated with risk, and this is during weeks 1 to 7. And then we saw risk associated with extreme hot temperatures. I mean, I didn't highlight those, but the cold temperatures were associated with a lower risk, and I can talk about this a little bit later too if we have time. Okay, and so then we're also interested in the whole pregnancy average, because that sort of, is an indicator for more chronic. The result that I presented earlier are more of a window specific. This is whole pregnancy. So we're comparing whole pregnancy exposure between those who are preterm to those who are not preterm, so full term, but we truncated the window of exposure so that they have the same length of exposure. And then we stratify this by week. And so as you can sort of see here, cold temperature again was associated with lower risk, but high temperature was associated with higher risk, especially during sort of the end, like towards the end of pregnancy. So point here is we see an association more of the, in more of the like later in pregnancy, for event later in pregnancy. And so then I mentioned we're also interested in the acute, right, exposure. And so we actually implemented something called a case crossover analysis, where instead of comparing exposure among those who have the outcome and those who do not have the outcome, we don't do that because we're afraid of, confounding, right? Because these people might be very different with with respect to a lot of different factors. And so what we did was we chose a case crossover analysis in this case, where we are comparing the exposure right before the time of the event compared to the exposure during some other time during which the event did not happen. So this is the time of the event right here, right? So let's say it's day number 0, day 0. So we compare the exposure during day 0 to the exposure during some other time during which the event did not happen. And so if high temperature is triggering early delivery, for example, then we would expect that the temperature during this day is higher than the temperature during the other windows. But then, because of this design, each person serves as their own control. So we don't have to worry about time invariant confounding. So factors that do not change over time will not be confounders in this case. And so, that's sort of, I can talk more about the study design if you're interested, if any is interested, but for the sake of time, moving forward. And so this is what we found. So during the cold season, each 5-degree decrease in the temperature was associated with increased risk for all 3 outcomes here, a sort of similar increased risk for all 3 outcomes. And so, and again, this is for 5-degree decrease in temperature in the cold season was associated with higher risk. And so colder is worse, right? In the warm season, on the other hand, every 5-degree Fahrenheit increase in temperature was associated with increased risk sort of across the board for 3 different outcomes. And so then I guess point here is cold is bad during the cold season and hot is bad in the warm season. So the extreme temperatures are, neither of them are good, right? Neither side is good. Okay, I forgot to talk about the highlight. And so I mentioned a little earlier that I was going to share some findings related to extreme temperature and preterm birth, but I also wanted to share a little bit in terms of the mother's outcome. What does it look like for the mother? And so for this study, we used the same study design, so the case crossover design that I just briefly described a little bit earlier. But instead of preterm birth, now we're selecting pregnant women who had basically a cardiovascular event around the time of her labor and delivery in medical record. And so this was a linkage of medical record and delivery record. I know I didn't mention this, but so if they had any cardiovascular event, we using ICD-9 and 10 code, ICD-9 at that point, we basically select them to be in the study. And we only had 680, which is actually, these are pretty rare events. But so we couldn't really stratify for the specific types of cardiovascular event, if you're curious. So we kind of lump them all together. But anyway, so these are the result of a cardiovascular event in the cold season associated with a degree decrease in temperature. And so we kind of see here that the decrease in temperature was associated with increased risk of, or in this case, odds of cardiovascular disease event during basically the week prior to the event. And so in this study, we were also interested in kind of like identifying whether at the same level of heat exposure, whether there are any subgroups that are more impacted by it. And so we stratify the analyses by race ethnicity, as you can see represented by the different colors on the screen. So this is cold season. We didn't really see any important interaction. So we didn't see too much of a difference in terms of race ethnicity, except for that we saw that Hispanic population they seem to have a slightly higher risk compared to the rest of the group here. That's cold season. Colder temperature associated potentially with a higher risk. And then this is for the warm season. And so here, this is for the odds ratios that you see here are for a 1 degree Celsius increase in the average temperature. And so here, here we saw an increased risk kind of almost across the board here, but here is really where the strongest impact is. So this is the temperature during the day of the event and temperature during the day before the event. So we see sort of this acute impact where, today there is an increase in temperature, the risk increased on the same day or the day after. So kind of a little bit of some immediate, but a little bit of a delayed impact by 1 day as well. And we saw that Black pregnant women were more impacted at the same level of temperature increase. All right, so then, okay, so we kind of briefly discussed temperature. So let's I want to also talk about air pollution, because as the climate conditions shift, we also will expect to see, these conditions are going to be conducive to air pollution formation. So wildfire, and we have a lot more longer summer, for example, we're going to probably see more ozone, because ozone is not directly emitted from the different sources. It's a secondary pollutant, and so it needs light and heat to form. And so we have these conditions that are more hotter and sort of like longer summer. Ozone is probably going to be an issue as well. But anyway, so air pollution has been studied for many different health outcomes, especially cardiovascular and respiratory health outcomes. It hasn't been studied that much in relation to pregnancy outcomes, but there are some studies out there, and we're starting to see a lot more within the past maybe 2 decades. And so the reason or the mechanism through which air pollution can impact adverse pregnancy and reproductive outcomes would include sort of these blood viscosity and epithelial function. And this is actually from the cardiovascular disease literature. It's pretty well established, I would say. And these changes will definitely impact the maternal and fetal exchanges, and therefore impacting their oxygen and nutrient exchange. And that may have implication on the growth of the baby and, of course, preterm birth as well. There are endocrine disruption mechanisms that may link air pollution to adverse pregnancy outcomes. And these ones are the ones that I have studied, our team has studied, but we see that shortly after exposure to, say, air pollution or extreme temperature, the levels of inflammatory markers and oxidative stress increase within 48 hours. And so the studies that I was involved in were not pregnant people. So they were more healthy volunteers, because right, exposing pregnant women to air pollutants are, it's hard to get IRB approval from an ethical perspective. But anyway, so these were healthy volunteers that I was talking about, but it supports these mechanisms. And then, it can, air pollution can also impact the father. But, overall, I don't think I will have time to dive into the, the different biological mechanisms, but there are established biological mechanisms that we know of for other literature that may actually be consistent for pregnancy outcomes. So, so in my work, I have studied air pollution and reproductive health, multiple reproductive health outcomes. So that includes outcomes for the mother. So these are fecundability. So this is sort of like, how much time it takes for somebody to get pregnant if they were to try to become pregnant. So fecundability. So air pollution, we've seen that they reduce fecundability. We've seen cardiovascular event, increased cardiovascular events risk, increased risk of gestational diabetes, gestational hypertension. For the father, we also seen that increased air pollution exposure also decreased semen quality. And then for offspring, this is where, a lot of my work focused on is, so like we've seen that air pollution increased the risk of multiple offspring baby outcomes, including fetal outcome, including pregnancy loss, stillbirth, premature rupture of the membrane, preterm birth, low birth weight, birth defect, and even neurodevelopmental outcomes when the baby is, even for the baby who survives, right? So this is for when the baby grows up. And so a whole suite of different adverse health outcomes that we found in our studies. Now, I know, of course, I won't have time to go over, all of these. So I'm going to share one study, and I'll keep it preterm birth just to be consistent with the study that I presented earlier. I actually was originally going to present for another outcome, but I thought it's just going to make the presentation too long. So I'm going to keep it preterm birth just to save some of the time. So preterm birth. And so this study was recently published, well, not recent anymore. It was the end of 2021, so exactly a year ago. But since I'm at UC Merced now, which is located in the San Joaquin Valley of California, and we know that this area is significantly more polluted compared to the rest of California and to many other areas of the nation. And so so I was immediately, when I came here, I was like, okay, I'm interested in, how air pollution impacts birth outcomes in this region. And despite the fact that we're highly polluted and the pregnancy outcomes in this area is not as favorable compared to the rest of California, there's not that many studies in this region. And so that's sort of where I'm coming from. So we decided to do this study. It took a while because of COVID and I couldn't access the data, all that, but fun story. But anyway, so this study took place in 8 counties of the San Joaquin Valley. And you can sort of see here, the San Joaquin Valley is right smack in the middle of the state where it's a valley. And so it's basically a bowl. And so, and like when the air pollution comes in from the north, so like San Francisco, for example, it gets very stagnant in the area. There's not a very efficient way that we can get rid of air pollution. So it's just like, there most of the time. And so it's one of the reasons, so the topography of the region is one of the reasons why we're having very high air pollution in the area. But anyway, so that's the 8 counties of the San Joaquin Valley. And in terms of study design, I chose the same study design that I described a little earlier. That's why I'm saying, I can save some time if I focus on the same outcome and sort of the same study design. And so we use this time stratified crossover design where we're only focusing on the cases that are affected by the outcome, but we're comparing the exposure right before the outcome happening to the exposure during the time that it did not happen. So just sort of let's recap again. We compared the exposure during the time of the event, right? Like the week before the event, to the exposure during some other time. And I'm gonna explain a little more here in terms of what I mean by the other time. So these blue bar, right? So like it's important that we select the most appropriate control right, time windows as possible. And so we chose the time stratified scheme because it has some strength. It's an improvement of the design that I described earlier, actually. So basically what it is if you have a case that's, let's just say, that's happening on the 12th of January, I'm making this up. I don't know if this is actually a calendar. So the 12th of January on a given month. So that's going to be the case day. And we're going to be comparing the exposure during that day to the exposure of all of the other Mondays in the same month. And so what this is doing is that we're controlling for a week of the month and day, well, the month and then the days of the week, because people have their activity, sometimes changed by the day of the week. And so that's what we did. So here's another example. If somebody were to have a preterm birth on the 22nd of January here, then this is the case period, and all the other days represented in blue are going to be the control days. So that's sort of what the study design was. Okay, so anyway, so we had in our so of course we had California birth certificates. We excluded those who are kind of like, are less than 20 weeks of gestation for data quality purposes. And of course we excluded those who are more than 39 weeks of gestation, because those are full term. We're not interested in the non-cases. We excluded some that are having kind of like not very reliable birth weight and all that. And so at the end of the day, we had about 200,000, right? 196 or 197,000. And so, and just wanted to give you a little bit of breakdown in terms of what are the proportion of each of these different level, I guess, of a preterm birth here. So the majority, of course, are going to be early term, 37 to 38. And then we go down for preterm birth, 34 to 36, and then very preterm birth, 20 to 34. Okay, and then exposure. So we were using daily air pollution estimation from the San Joaquin Valley Air Pollution Control District. And we thought we used that because, their air pollution exposure is what's used for policy making in the region. And so we used that for our study. So we basically estimated, we overlaid the air pollution data from the San Joaquin Valley Air Pollution Control District. We overlaid that with the maternal zip code at delivery, and we we estimate the exposure during the 7 days before delivery, and then of course also during the control windows that I described earlier. And so we have here the results. So across the board, the different lag days here. So 7 days before, 6 days before, 5 days before, and so on. So we saw pretty much consistent increased odds ratio for early delivery associated with ozone exposure during the warm season. So we stratified by season because of seasonality. And so ozone was associated with increased odds of preterm birth sort of all across the board. Same here, and this is for PM 2.5 exposure during the cold season. We see this kind of, some of the findings were not significant, but overall the magnitude of association suggests increased risk as well, although the risk here is not as high as for ozone as you saw on the previous slide. And so I just shared with you some of the findings in from my work, right? But what does the state of the literature look like right now, right? So I just wanted to share some of that too. So in 2020, there is to me is a very important I guess, review paper, systematic review that came out, and it sort of looks at the literature and summarized the impact of air pollution and heat exposure on preterm, low birth weight, and stillbirth in the US. And so there were 68 studies total at that point. And overall, so like, let me share this right here. So the authors basically did not a meta-analysis, but sort of like more of a narrative review kind of, but they quantitatively summarized the data in a way. So this is the association between air pollution, right, and preterm birth, low birth weight, stillbirth. And so 19 of the 24 studies that looks at the association between air pollution and preterm birth found a positive association. And so you can sort of see here down the list, I guess, down the table here is the majority of the study that looks at these association found positive association. And then the study also found that many of the study actually also found that there is disparity, racial disparities in these findings. In other words, at the same level of exposure, racial minorities have higher risk compared to the majority population. And so, but then another important point is that not that many studies actually looked at these. So 10 out of 19 saw that, but like about half the study, 13 out of 25, etc. So there is evidence of racial disparity, although there's not that many studies that evaluate that trend. Okay. And then in the same year, there is another study that looks at this as well. And this study is actually a systematic review and meta-analysis. So very similar in purpose, but slightly different methodology, I would say. This study included 70 studies that looks at the association between high temperature and pregnancy outcomes. And they found that overall here, so for preterm birth, pretty much when summarizing all the studies that are out there, the odds of preterm birth increased during the heat wave. And if you looked at sort of the continuous exposure for temperature, the odds of preterm birth also increase with increased temperature. And even if somebody were to categorize, high versus low temperature, there's also evidence of increasing risk with the high exposure. Same trend with birth weight, and then stillbirth, there's sort of the same similar findings sort of, overall. And so the same study also found that the impact of, extreme temperature is higher in Black populations for the different outcomes, and then Hispanic populations as well. So whatever is highlighted here is representing the subgroup within the specific studies that looked at a susceptible subgroup. And so essentially, minorities are having higher risk. And so where we're talking about disparities, I want to bring up environmental justice, right? Because we cannot really talk about climate change and health without even talking about environmental justice. And it's a whole topic of another day, but we all know across multiple literature that people of color, low income, and indigenous communities are most impacted by climate change, through compromised health, through social and cultural disruption, and financial burden as well. Now, globally, and in the United States too, these communities often contribute the least to climate change driver, but they often lack the resources, and there's a typo, the resources and the voice to mitigate the climate impact. And here I have a graph of the countries, so this is on the countries level, and on the top is the contribution to climate change. So this is represented by CO2 emission per capita. And then at the bottom is the vulnerability index. So they kind of, comprise of all the different vulnerability associated with climate change. And you can see exactly the inverse. The country who contribute the least here, low emission, are the countries that are having, more vulnerability. And so that's sort of a thing that we need to keep in mind as we move forward in the field. And so I want to talk a little bit about climate, policy changes as well. So with all these findings, right, what have we done? There is, I guess, some good news, right? So in 2021, actually, President Biden actually tweeted about it, recognizing that this is a problem, and there are certain populations who are hit harder by climate change. And so in January of 2021, he issued an executive order, as you probably have heard of, on tackling climate crisis at home and overseas. And he emphasized the need for government-wide approach to address climate change. And so in response to this, the HHS, the Health and Human Services, enacted a climate plan action. And one of this is to establish an Office of Climate Change and Health Equity, which I think is a very good start, right? And so hopefully we can there's some I guess, more progress that's going to go there. And then in 2021, around the same time, we had this bill, HR 957. And this basically is a bill, I think it's still sitting there in the House, but so a step forward, right? And so the bill establishes grant and direct other activities to address health risks associated with climate change, particularly for members of racial ethnic group, pregnant and postpartum individuals. And so we now, Roy, of course, recognizing that pregnancy outcomes are important for climate change exposure. And so then I also mentioned a little bit earlier, in 2022, the IPCC, the sixth edition of the IPCC, did mention pregnant people as a vulnerable population. So that's also another step forward. And then with respect to clinical practice, ACOG actually did have a guideline that was published in 2021 as well. So a lot happened in 2021. So they published a guideline that actually help, I guess, clinicians, in terms of how to do environmental assessment for their patient. And this is really important because a lot of time environmental exposure, even though they contribute to pregnancy health, like we don't really talk enough about those, right? And clinicians are often not don't talk about those. So there's this guideline now that's available, and I think this is moving the needle a little bit forward. So related to that, there are multiple surveys of healthcare providers across the world. And so like from all these surveys, we know that the majority of healthcare providers across different countries, they recognize that climate change or acknowledge that climate change is real and has impact on pregnancy health, and that taking history is important. So the majority of them believe that it is important. Now, in the survey also, it shows that few of them actually ask or discuss with their patient about exposure and risk. And some of the barriers that are reported include the lack of training, the lack of resources, and time that are available for them to do so. And so some of the recommendations that the participants generally suggest is continuing education, communication training, patient education material, policy statement guidance, and action alert. And so I think that, the fact that ACOG is now on the board, right, and all these different federal changes as well as some local changes, I'm hoping that we can move this forward. Now, so I've talked a lot about impact of climate change indicator on health at this point, but I also want to discuss the potential intergenerational effect of it. And the reason is because as the climate conditions get worsen, right, we're going to start to have more like less healthy parents because of all these, right? So we know that climate change impact cardiovascular disease risk, respiratory, and all these different health, chronic health conditions, which I didn't talk about, but in one of the slides you probably remember, right? So as the climate conditions worsen, we're going to have less healthy parents who are going to have less healthy pregnancy. And those, right, like pregnancy are going to be more likely to have adverse perinatal outcomes. And these babies who are growing up, when they reach their reproductive age, they're going to be less likely to have a healthy pregnancy. And so like the cycle kind of goes forward, especially when the climate change event and the existing vulnerability are like constantly with us. And so so like, right, so the parents go into child who then will become parents, and and this sort of like repeating cycle it's concerning. I think if we want to think about the impact of climate change, we not only have to think about it within a lifetime, but also sort of like, multiple, like sort of this sort of like repeating cycle that we need to interrupt in order to mitigate climate change impact. And so there are a ton of challenges that we have to consider when we're studying ambient environment. And this, I can speak personally to these because I've seen many of these in my studies, and not sure exactly like what we can do immediately to do that, but there is so much challenges in here. And the first one being how do you measure these things accurately, right? Air pollution, temperature, like a lot of time we have to rely on existing data, because as you can imagine, asking people to wear these monitors across time is very difficult. We actually have a study that did that, but I can share with that later too. But most of the time, we don't have personal monitoring to capture residential relocation. People move all the time. People have daily activity and they're moving around space all the time. So how do we accurately capture their exposure? We have complex interaction between the different climate-related exposure. Like how do we think about all of that? We have susceptible windows of exposure during which the exposures are more relevant, and how do we identify that for intervention is difficult. And from a methodological perspective, there is autocorrelation and collinearity of the different pollutant. How do we take care of that? And then difficulty in measuring the outcomes as well. So outcomes like stillbirth and pregnancy loss were extremely difficult to capture. And so we really, prospective cohort study is really the way to go. We had done one of those, but there are challenges with prospective cohort study as well. And then we have limited data from vulnerable groups that are more impacted. And then, of course, lack of funding. It's really hard to find funding for climate change research, but I'm seeing things moving in the right direction now. So I'm really hopeful that we can get more funding to do such work. So anyway, Claire mentioned this a little bit earlier, but there is, I'm involved currently in some of the work to continue whatever I'm talking about, right? So one of which is to leverage existing data in the state of California. And we have a pretty robust linkage system where you can link hospitalization and, oh, I think the power just went out. Oh my dear. I hope that the internet is still on. So we have a pretty robust linkage system where we can link hospitalization and emergency department visits to vital statistics. So hopefully I can use these, linkages to further study pregnancy outcomes related to the environment data that are publicly available. And then we also have this, I'm collaborating with a collaborator from New York, who's working on, she was previously at NICHD, she was my mentor. And so we're working on this something called a Be Well Mom study. And in this study, pregnant women are actually wearing a personal monitor. So we can estimate air pollution exposure and temperature exposure in a more accurate way than we used to be able to. And so we're measuring health outcomes for both the mothers and the baby. And so hopefully in the future we can do some interesting study out of that. And then there are these two pieces. I'm moving forward. I am collaborating with the community, especially the community who are more impacted by air pollution and climate change in general, and study those issues in the San Joaquin Valley where I am right now, where the university is right now. And so I know I'm like, I should leave some time for Q&A, but I want to leave us with a positive, optimistic quote here from the Lancet Countdown, which is a group of researchers who published annually in the Lancet about climate change and health. But they in 2021 mentioned climate change is the biggest global health threat facing the world in the 21st century. But it is also the greatest opportunity to redefine the social and environmental determinants of health. And so I thought, yes, we're, I really like the sentence, just because the quote, because I know we have a lot of work to do, but there's a lot of opportunity for us to improve, maternal and child health moving forward. So I want to acknowledge my funding sources, and of course, thank you for listening. And I really hope we have some time for, Q&A, and appreciate your time.